if we got too many medications, what's going to happen? I mean, there's a whole bunch of worries, stigmas, myths, and everything about that. Can we go into some of these worries and myths, and if we can alleviate some people's concerns?
There are many fears and concerns regarding pain management. And to be clear, pain management is not just medications. There are alternative ways to manage pain as well. It's been more and more in the news, and it's been more and more documented by the American Journal of Medicine that things such as aromatherapy, such as music, such as laugh therapy, or looking at comedy alleviates pain. So we have to think of it in a very much more holistic approach other than medications. Mm-hmm. And people have to understand that, because it's more than just a pill. There is no one pill that takes all of our pain away. Mm-hmm. And we really have to think in a broader view. So someone who is taking medication, we can't think of them as an addict or a wimp or someone weak or a drama queen or a complainer. We have to give credence to the fact that they are experiencing pain. Mm-hmm. It is very important.
Well, I think that a lot of people are fearful that they will become addicted to their pain medication. And most people think of pain and the alleviation of pain by taking a medication. And a lot of people want to hold back because they don't want to become addicted, because that's what society tells us, is that if we take too much, we're going to get hooked, and then we're never going to get off of it.
Cassandra, I think that's probably one of the biggest barriers that we have in this country. And the sad thing is that that's been a barrier for probably 30 years. I teach pain courses around the country, and to nurses, to patients. And one of the key messages that I always want to give is that addiction is a barrier to adequate pain management. And unless we look at that barrier, that we're not going to change the statistics in how well we manage pain. So the fact of the matter is that people that don't have a history of addiction or don't have a lot of risk factors of addiction have a really very low risk of becoming addicted. You know, the media is really fighting against those of us that are in pain management. You can't, open a newspaper or a magazine and find out a story of somebody who got addicted to their pain medication. And the media makes it look like addiction is, a common problem that happens all the time in patients that take medication. And really it's not. It's not a common problem. It's a very small problem. In people that have a history of addiction, yes, then the likelihood is more. If people have risk factors of addiction, like, they've gone through a lot of loss, they've had a lot of deaths, they've lost their job, they're in financial trouble, they've never been good at coping, they're depressed, they're a dependent personality, many of these risk factors put people at risk for addiction. But the general person that comes into the hospital for surgery or breaks his leg after a fall or, has a painful condition, most of those patients aren't going to get addicted to pain medication. What we recommend for patients is if they have a history of addiction, that they be upfront and they talk to their doctor about it, because, we're going to need to treat them differently if they have a history of addiction than if they don't have a history of addiction.
And for those people who have the break and have been given a prescription for, let's say, 10 days of a pain medication, they do not have to worry about becoming addicted if they take it for the 10 days and then they stop.
Well, Cassandra, it occurred to me as we're sitting speaking that the public really doesn't understand what addiction is versus physical dependence.
Absolutely.
Addiction has behaviors associated with it that is a disease process where people crave the drug and will do anything to get the drug. Those are aberrant behaviors. Now, physical dependence is when someone takes a pain medication and they're on it for an extended period of time and their body expects to get it, and they have an adverse reaction if they do not take it. That does not mean they're addicted. They are taking their pain medication that's needed. Mm-hmm. So there's two different areas that are being co-mixed inappropriately. Addiction is a disease. Physical dependence is an occurrence that happens when you take medications for an extended period of time. And and both can be dealt with properly with appropriate pain management.
That's so true. A lot of people come to me and they say, my family tells me I'm addicted because they're taking their pain medicine every day. Think of it as if you have high blood pressure or you have cardiac disease or you have diabetes. You take medicine every day for those problems. If you have pain, chronic pain, you take pain medicine every day for those problems. So it doesn't mean that you're addicted because you have to take pain medicine every day. It just is part of the treatment plan for your particular diagnosis.
And the point being is that our lives will be far more comfortable, we'll be able to function, we'll be able to work, we'll be able to do what we have to do.
That's the goal.
Okay. We mentioned in the top of the show that that healthcare providers have responsibilities and patients have responsibilities in healthcare management. So why don't we go over what the healthcare providers' responsibilities are? Let's list what they are. Karen, your turn.
The first responsibility is for the healthcare provider to identify the person's pain and to appropriately deal with it in a timely manner and to believe the person with pain.
That's pretty good. Believe your patient when the patient says they're in pain.
That is correct.
And do something about it quickly.
Yes.
Okay?
We also need to look at, our responsibility as a nurse is to look at the family dynamics, the cultural dynamics. I've taken care of many patients over my career that just have, there are many people that believe in natural healing. There are people that think you don't need medications to take care of your pain. You can take an herb, you can have a massage, you can do a different treatment modality that's not medicine. And for us in the medical field, when we know that we can give you, a medication that can alleviate your pain and you're telling us that culturally that's not acceptable to you, we need to listen to the patient. We need to understand where they're coming from. We need to educate them as to, yes, this may be effective, but medication is also effective. And at some point, in the process of your disease, you may need medication, and your herbs and your non-drug therapy may not work. You may need a little pain medication. So we really have to look at the cultural issues.
So you're talking about there's a combination that one can enhance the other and provide greater comfort zone here. What about those patients who can't speak, though? Those people who are unable to talk to you?
Well, not just unable, unwilling, or not understanding that they have a right to appropriate pain relief. Those patients the nurses have to advocate for. The nurses at Overlook Hospital feel empowered to step up to the plate and say, my patient is experiencing pain and I need to do something about it right now. And they do that by observing them, by looking at how they interact, by looking at their limitations. Are they able to get out of bed? Are they able to walk? Are they able to laugh with family? Are they drowsy? Are they sleeping? Are they restless? Are they agitated? And this is the opportunity for the nurse to step in and help that patient. We as nurses have a responsibility to assist our patients in every manner that we can to provide healing.
So you're saying that you're advocates for your patient by, number one, caring, and number two, observing the symptoms and the lack of symptoms as well. Is that right, Fran?
Yeah, I think we need to, nurses are advocates, that's a given. And pain management is something that we really need to advocate for. The statistics say that 50% of the population does not have their pain adequately managed, which means that we really need to, as Karen said, step up to the plate. So how do we advocate? We really focus on empowering our nurses to advocate for pain. One of the ways we do that is back in 2006, I developed a 3-day pain resource nurse course, PRN, Pain Resource Nurse. It's a 3-day course that just teaches the nurses about pain management. We've trained over 250 nurses in the Atlantic Health System, both at Morristown and at Overlook, and in other hospitals in pain management, so they are comfortable in understanding how to assess patients' pain when they can't speak. What kind of drugs should we be using to manage their pain? What do we do if the interventions don't work? How do we call the physician and explain to him what's happening and how we need more medication and how we can advocate for the patient? So we've trained our nurses because they're the key advocates. We also last year in 2009 created a 2-hour program for our nurses' aides